Ага, хорошо. Они меня видят?
Нет,
Ага.
слушай. Стрелочка наверх.
Ага. Ну-ка. Да, все отлично. Good morning. I'm sorry for wait. We have some problems with techniques. And let's start our lecture. If you hear me, please put plus in our chat. And let me introduce myself. My name is Tatiana Grigorieva, and we'll together from today start our cycle of lectures as stomatology. And let's start. Topic of our lecture today is dentistry as a science. Good morning. Methods of examination of patients with diseases of maxillofacial area, caries and its complications, tooth extraction and complications of it. And let's start from what is stomatology or dentistry or oral medicine. It's a medical discipline that studies structures of the teeth, causes, treatment and prevention of dental disease, diseases of tongue, mucous membrane of mouth, jaws and surrounding tissues of the face and neck. In task, dentistry also includes development of new materials for fillings and prosthetics. Dentistry also encompasses the treatment of correction of malformation of the jaw, misalignments of the teeth, and burst anomalies of the oral cavity, such as a cleft plate. And here you can see different dental specialities. On the left side of the slide, you can see specialties in Russian Federation of dentists or stomatologists, and on left side you can see specialties of American Dental Association. Of course, in Russia we have the same, but we divide only 4 types of dental care. Therapeutical dentistry in Russian, and you can see that it's a periodontics, endodontics, public health, and dentistry. And what is dental public health? That is a branch and specialty of dentistry concerned with the diagnosis, prevention, and control of dental diseases and promotion of oral health, thorough organized community efforts such as research, health promotion, education, and group dental care programs. Endodontics. Concerned with the morphology, physiology, and pathology of the dental pulp and periradicular tissues. And later we'll talk about structure of tooth and oral cavity, and you'll understand what is dental pulp and how we can care of it. Periodontics, concerned with the diagnosis, prevention, and treatment diseases and conditions of supporting and surrounding tissues of teeth or their substitutes, and the maintenance of the health, function, and aesthetic of these structures and teeth. Then we are going to the surgery, and truly said, I'm from surgical dentistry because most of our topics will about particular surgical stomatology or maxillofacial surgery. And what is it? Oral and maxillofacial surgery is concerned with and includes the diagnosis, surgical and adjunctive treatment of disorders, diseases, injuries, and defects involving the functional and aesthetic aspects of the hard and soft tissues of the oral and maxillofacial region and related structures. Oral medicine and pathology, it's a branch and specialty of dentistry concerned with the diagnosis, nature, and primarily non-surgical management of oral, maxillofacial, and temporomandibular diseases and disorders, including dental management of patients with medical complications. Oral medicine and oral pathology are 2 applied components of this specialty. And Prosthetic dentistry is concerned with providing primary and comprehensive preventive and therapeutic oral health diseases care and consultative expertise for infants and children. Oh, I'm sorry, it's a pediatric dentistry. And as you can understand, pediatric dentistry, it's all structures of dentistry for children and infants. And prosthetic dentistry is concerned with the diagnosis, restoration, and maintenance of oral function, comfort, appearance, and health of the patient by the restoration of natural teeth and or replacement of missing teeth and contiguous oral and maxillofacial tissues with artificial substitutes. And here, pay attention that prosthetic dentistry, it's not only prosthetics or artificial tooth misalignment for the tooth. Yes, we can use prosthetic dentistry nearby the surgery because, for example, if it was a trauma of patient, car crash or some other types of the trauma, and patient has some absence of, for example, ear, nose, or alveolar bones, and prosthetic dentistry, we can use it for replacement of these missing structures. And the next, I get that you have a lot of questions. What for do we need stomatology in our studies? But if you're going to be a good doctor, so you have to understand that there are a lot of relationships between teeth and organs. And of course, teeth and maxillofacial area has a lot of different structures and organs, which we can see by first visual examination by the patient or our friends and relatives and by yourself. And of course, you have to understand what is going on when you see some inflammation or disorders or traumas, and how to take care of this patient and what to do, or what specialists should treat these problems. And next, it will be relationships between teeth and organs. And holistic medicine is founded on the belief that the entire body is interconnected. In particular, certain teeth are linked to specific organs. The relationship between teeth and organs is so strong that experienced holistic dentists can determine patient dentistry history strictly by examining his past and present physical symptoms. And it is possible also to suggest which of patient organs might be at risk from certain conditions. For example, the four front teeth are related to the sinus and kidney, while the sharper teeth or canine on other side is connected straight to the eyes and liver. This means that when a tooth suffers damage, the corresponding body organs might suffer as well. The opposite can also true. When a body organ suffers, it has the potential to cause pain and suffering in its corresponding tooth. Unfortunately, in Russia and in Ukraine and in our countries, we see the patient as disconnected parts or organs. But truly said, it's all our organism, it's a holistic, and we should see it in connection between of all organs and face, head, neck, body, and hands and legs. Complete examination of patients with some disorders and injuries in dentistry or maxillofacial area consists of next parts. It's a general examination. Briefly assess the patient's general appearance. Then extraoral head and neck soft tissue examination focuses on the head and neck. And intraoral soft tissue examination, it determines if the soft tissue is within normal limits. And let's start from the general examination. I hope you know it, but let's repeat in few words. The examination starts as soon as the patient enters the dental operatory. The patient's general appearance may give clues to medical conditions. As a patient enters the room, the during history taken, observe the patient's general appearance, symmetry, gait, and mobility. During the history taken, note any facial asymmetrics, lesions, or scars. Extraoral head and neck examination. First, of course, it will be asymmetries. Asymmetries of head and neck are assessed by standing directly in front of the patient. Compare one side of the head and neck to other. Most people are not completely symmetrical, but significant asymmetries should be noted and course obtained from the patient if known. Examples of asymmetries are previous surgeries, nerve paralysis from CFA, stroke, tumors, infection, traumas, and a lot of different ways. Then we should examine lymph nodes. Lymph nodes in the neck and head area should be palpated gently to look for tenderness or enlargement. Normal lymph nodes are either not palpable, or you may feel a lymph node that is size and shape of a small pear or lentil. These are mobile and non-tender. Abnormal lymph nodes are generally large, fixed, and may be tender. Tenderness of lymph node generally indicates inflammation of, or drainage of infection. And of course, you know that cancer metastasis to lymph nodes is often a fixed, non-tender, firm enlargement. Lymphoma is another possible cause of non-tender enlargement of lymph nodes on neck. And of course, if you see such lymph nodes which is enlarged and not tender, you should think about something more serious that inflammation. And on these pictures, on the slide, you can see different groups of lymph nodes in maxillofacial area, and you can see periauricular, postauricular, suboccipital, submandibular, submental, cervical, and the supraclavicular lymph nodes, which are interested in. Temporomandibular joint, you should examine it too. Not only by visual examination, you can use some palpation for it, and you have to place fingers over the temporomandibular joint with a gentle pressure. Note any tenderness, swelling, or redness at rest. Ask the patient to open and close slowly several times his mouth, and then ask the patient to slowly move the mandible from side to side in open position. Record any tenderness, pain, clicking, crepitus, deviation, or limited opening. Then we are going to examine salivary glands, and as you know, we have a lot of little or salivary glands in our mucous membrane in oral cavity, but major salivary glands only 3 pairs, and you should palpate it and make to assess salivary gland duct orifices, potency, and salivary flow, and to evaluate the quickly of the saliva. And when extraoral tissue examination is understandable or clear, you can go to the intraoral soft tissue examination. This is important to record if the soft tissue is within normal limits or not. If there is an abnormality, further details are noted, such as type of abnormality, for example, polyp, macule, ulcer, or other types, size. You can measure it, color, location, surface texture, for example, smooth, papillary, lobulated, and consistency, soft, firm, fluctuant. And next, we are going to examine lips. The same, some abnormalities, size of it, color, location, surface texture, and consistency, if it's present. Then buccal mucosa or vestibular mucosa. And here, do you know what is vestibular mucosa? It's an oral mucosa between teeth and lips, and we call it vestibular. Hard and soft plate, oropharynx, tongue, floor of mouth, gingiva, and alveolar mucosa. The maxilla and mandible should be palpated to check the enlargement, such as exostosis or tori. This examination may also reveal tenderness that could be the result of infection or inflammation. It's important to record the findings of extraoral and intraoral examination. This is normally done during the examination process, and there are many different methods of recording results, including checklists and free text. And then we are going to the teeth examination. And as I said earlier, we have different types of dentistry or sections of dentistry, and of course, teeth examination we have to do in all these sections of dentistry to know if there are any abnormalities, damages, caries, or fillings or other diseases of the teeth. But of course, only therapeutic dentists can treat it. And we start teeth examination from oral hygiene status. The dentist or dental hygienist uses instruments such as a mouth mirror, periodontal probe, and explorer to examine the teeth. Every tooth is checked for cavities and conditions and positions of the teeth. Both erupted and impacted are noted. Previous treatments such as crowns and other restorations are evaluated. The dentist's observations are recorded in a tooth chart. The jaw joint and bite are evaluated, since the irregular bite can lead not only to excessive wear on the teeth, but other dental problems as well. The fit of dentures and bridges is worn are inspected. The dentist evaluated the gingiva or gums tissues for periodontal disease. Periodontal probe measures the depth of the pocket around each tooth. If the gums are healthy, and pocket will be less than 3 millimeters deep. Pocket in 4 millimeters or more indicate periodontal disease. The deeper pocket, the greater chance for tooth loss unless treatment is begun. And on this slide, you can see photos of different types of diseases and misplacement of tooth. And on first slides, you can see caries, and we'll talk about it later. And pay attention that you can see cavity inside the tooth, and it's a brown cavity. Next slide, next photo, it's an incorrect position or dystopia of canine, as you can see in the left side of the patient. Diastema, or a space or gap between two teeth, and usually it can be between the central incisors, but diastema we can see between another tooth. Recession of gum and bone, and as I said, it was it was a periodontal disease, and we have to measure a deepness or depth of periodontal pockets in each tooth. And the root caries, it's the next photo. And next, here, please pay attention on this slide, and because we will talk about teeth numbering. We have in stomatology different teeth numbering, but usually we use this one. It's Federation Dental Danish International Numbering System, or FDI system, where you can see that all adults have 38 tooth, and we can divide it into 4 quadrants or segments, 2 in upper jaw and 2 in lower jaw. And oh, I'm sorry. It's another one. Okay, let's talk about it. And here on this slide, you can see this numbering. And as you can see on this slide, we can name the last teeth 48. But all adults has only 32 teeth. But why we can name the last teeth 48? And here pay attention. We divide, as I said, our jaws on 4 quadrants or segments. First quadrant, it will be upper right side, or on the upper jaw right side, maxilla. And we'll start from 11. This quadrant, all tooth will have first number 1. Next, we are going to the upper left side, and all teeth will have number 2. Then we are going to the left lower part or mandible part, and the first number will be 3, and the lower right will be 4. And according to this numbering, we have to understand that first it will be central incisor of the upper right section. It will be 11. Then lateral incisor will be 12. Canine in maxilla right part will be 13, then 14 and 15 it's a premolars, and molars 16, 17 and 18. Then we are going to the maxilla left side, and we'll start from 2, and first incisor or central incisor of the upper left side will be 21, and the same we are numbering to the 28, and the last tooth in the upper left side or wisdom tooth will be number 28. Then we are going to the lower jaw, and first central mandible incisor on the left side will be 39 till 38, of course, and the last one 41 till 48. And if you'll see, for example, X-ray, which is signed as 45, it doesn't mean that the patient has 45 tooth. It means that it's tooth, fifth tooth on the lower right section, or in the mandible in the right side, and it's second premolar. And of course, if you see the 18, you understand that it's maxilla right side. I hope it's understandable. If you have any questions, you can ask it in chat, and I'll answer it on it. Next, you can see a slide with another different teeth numbering systems, and you can see angles, which shows us what part of the maxilla or mandible with tooth. And on this angle, we also can write number of the t's. For example, angle which goes to the upper side right, and you can write on this angle, for example, number 6, and it's understandable that it's a maxilla right part, 6 tooth from the central part. And numbering with the words. Oh, I'm sorry what I have done. And on the right part of this slide, you can see. Oh, I'm sorry. I have some problems with computer. On the right part of the slide, you can see another numbering system, 55, 54, 53, and even 85. And as you can guess, it's a numbering for milk teeth or deciduous teeth. And child has only 20 teeth. And of course, we have to understand if it's milk teeth or permanent teeth, and in our teeth numbering system, we can find, for example, 16, and near these 16 tooth, we can find 55. And that is mean that it's a milk teeth, and 16, it's a permanent teeth. Так. I'm sorry, I have some problems. 2 minutes and I will come back. I can't list the slides. Так, и что же произошло-то? Okay, and while we are waiting technic masters, let's talk about T structure. I think you know that every tooth consists of three parts, main three parts. It's a crown part, which we can see in our mouth or oral cavity, then neck part and root part. And what can we say about different types of the tooth? First, as I said, it's incisors. It's a front group of the tooth. Incisors, we have two different types of the incisors. It's a central incisor and lateral incisor, or middle one and lateral one. Then, after incisor, we can find canine. It's a sharp tooth which is served by our teeth numbering system. Then after canine we can find two premolars, and after these premolars we can find three molars. And of course wisdom tooth is usually impacted, or we can see it in the oral cavity, but we can see by, for example, X-ray examination, and know about that we have wisdom tooth. Or after 11s, usually it can be erupted. And let's talk about crown part, more useful. Crown is a visible part of the tooth in the mouth, while the root is hidden beneath the gingiva and alveolar bone. It has a pearl white to yellowish color depending on the thickness of enamel, the age of patient, their oral hygiene, and lifestyle choices. The enamel is the outer layer of the tooth, and it's extremely hard and durable. And of course, you can see different types of the colors, as I said. It can be white or yellowish, and it depends, pay attention, of thickness of enamel, because we can see underlayer dentin, and particular its color, we can see as a color of the tooth. Underneath, though exterior layers and second layer, more soft layer that is slightly darker in color, and it's known as a dentin. This is a capsule that separates the hard outer tissue from the soft and fragile. Здравствуйте, что-то я тут нажала, что оно не идет. О, спасибо. And here everything is okay, and you can see the slide with the types of the tooth. It's incisors, canine, premolars, and molars, and you can see it's by the different colors on the slide. Next, and here we were talking about tooth structure and in a few words, enamel. You can see outer layer, it's a hard tissue of the tooth. It's the most hard tissue, not only of the tooth, but in all our body. It's harder than the bones of cortical plate of the bones, for example. Next, it's inner part, or inside the enamel, we can see dentin. Dentin, it's a hard tissue of the tooth. It's more soft than enamel, but we can say that it's hard tissue of the tooth too. Dentin is next layer, and it lays under the enamel in the crown part and under the cementum in the root part. And inside the dentin, you can see pulp cavity. It's a chamber with the soft tissues of the tooth, with the pulp. Pulp, it's only, I can't say that it's a type of the tissue, because pulp, it's a blood vessels and nerves inside the tooth. But we can say that it's a soft tissue, not type, because type it's vessel types, yes, and but soft tissue of the tooth. And what is a cementum? I said that cementum covers root part or hidden part of the tooth in alveolar. It's a hard tissue which connected with outer layers or ligaments, periodontal ligaments, which covers superficially alveolar part of the bone or alveolar processus inside the bone or inside the maxilla and mandible. And here you can see molar tooth, and it's a lower molar because we can see two roots. And of course, in different types of the teeth, we can find different types of the root, and its amount. We can find tooth with one root, with two roots, which are separated one of other, and we can see three roots in molars of upper jaw, and even four roots. They can be separated, they can be together, and it's necessary to know for therapeutic dentists or endodontics when, for example, patient have a pulpitis and we have to extract this pulp in order to treat teeth. And the next slide, it's lab investigations. And here you can see different types of lab investigations in dentistry. And of course, most of it we can use in surgery. But, for example, X-ray or radiographs usually should be taken on the patient in all dental specialties. And let's talk particular about radiographs. On this slide, you can see different types of radiographs. or dental X-rays. They are divided in two main categories, intraoral and extraoral. Within intraoral X-rays, the X-ray film is inside the mouth, and within extraoral X-rays, I think it's understandable that the film is outside of the mouth. The various types of intraoral X-rays show different aspects of the teeth. For example, we can find cavities. We can look at the tooth roots, check the health of the bony area around the tooth, see the status of the development of the tooth, and otherwise monitor good of the teeth health. And here maybe you have any questions about it, because we can because I said that we can find cavities. Yes, we can see it by visual examination, but if the cavity is between the tooth, we can see it by visual examination, and even looking for the cavity by the mirror, special mirror and special sharp instrument, we can't find any diseases, tooth diseases. And only on X-ray we can find the cavities between the tooth, and this is very good for the patient and for us for good outcomes, because your teeth is most useful. And then extraoral radiographs. This can be considered as a big picture X-rays. They show teeth, but they also provide information of the jaw and the skull. Extraoral radiographs are used to keep track of the growth and development, to look the status of impacted teeth, examine the relationships between teeth and jaws, examine the bones of the face, for example, any fractures, traumas, and other positions of the jaws. And here you can see, for example, panoramics, X-ray or orthodontomographs, which is taken in surgery and in therapeutic and prosthetics dentistry. And as you can see on panoramic X-ray, we can see not only teeth but all jaws, sinuses, temporomandibular joint, and other structures of the maxillofacial area. And of course, CT, it most informative for doctors. And next we are going to talk about dental caries. It's the most widespread pathologies of the dental areas or of the teeth. And what is dental caries? It's infection of microbiological disease of the teeth that result in location, dissolution, and destruction of the calcified tissues. And two main factors contribute to tooth decay because it's a main factor of the caries. Bacteria in the mouth and a diet high in sugar and starch. There are over 500 different types of bacteria that are normally present in the mouth. These bacteria combine with the food and saliva to form strictly substance called plaque that attaches to teeth. Food rich in starch adds to the thickness of the plaque, which begins to get hard if it remains on the teeth after a couple of days and turns into the tartar or calculus. Bacteria in the plaque convert sugar into acid that dissolves the tooth structure, causing holes or cavities. Because of these two contributing factors, dental caries have been described as a dietobacterial disease. Factors that affect tooth decay are the following. It's, of course, tooth size and shape. Why? Because small teeth within numerous deep pits and grooves inside of it will be more vulnerable to cavity formation than larger teeth with fewer and shallow grooves. The grooves and pits provides area for plaque to build up and are difficult to brush thoroughly. In this way, for prevention of the caries, you should use floss. You can use it once a day, once in 2 days, but not after each meal, because you can do trauma to the gums. Next factor is thickness of enamel, and of course you can understand that enamel is a tooth's main defense against cavities. So the more of it a person has, the longer it will take for a cavity to break through the inside of the tooth. Next, it's a tooth position and bite. Crooked overlap teeth provide more areas for plaque to accumulate and are harder to keep clean. Many problems can occur if the bite is poorly aligned. Poor alignment of the bite can cause the enamel on certain teeth to wear down rapidly, leaving soft dentin. Tooth eruption time and sequence. People who get their permanent teeth early in life are at great risk for cavities because oral hygiene practice is not maybe developed yet. And next factors, it can be dry mouth because saliva helps wash plaque from the teeth and have antimicrobial species, eating and drinking, and of course eating and drinking is most fast factor of the risk because this is where it all begins. And since we all have to eat and drink to live, there's no way to avoid this, but it does play a significant role in the formation of cavities. When you eat or drink, carbohydrates remain on your teeth until you brush. Even after brushing, you may not be able to remove all food particles or carbohydrates from your teeth. Foods that tend to cling to your teeth can increase your risk of the tooth cavity. Be sure to brush your teeth regularly, especially after drinking milk or soda or after eating dried food, dry cereal, hot candy, caramel, and drinking such drinks as Coke and other gaseous drinks. And of course, medical problems, for example, diabetes, cancer, or other chronic, untreated, and different types of disease can cause caries, and it can be uncontrolled. And on this slide you can see caries classification. We have in stomatology different types of classification, and I'll tell you about part of it, and we'll say where you have paid attention. And the first classification based on tissue involvement, and depending on which tissue affected are distinguished enamel caries, dentin caries, and caries of cement. And here we can see different types of tooth, but all these types of the tooth, it's a hard tissues. Enamel, dentin, and cementum. And we can find caries of all these tissues. Of course, most serious it's caries of cementum because it's underlay of the gums, and we always can see it. And truly said, it's very difficult to treat because of saliva, and we can't soften it in right order. Next classification based on progression: acute caries, chronic caries, and arrested caries. And here we And here pay attention on this classification because only by visual examination you can understand if it's acute, if it's chronic, and even arrested caries. And what are the differences between these types of caries? Acute caries, and you can see it on the right part of the slide. What can you see on this tooth? Some cavity, yellowish or whitish on the color. It can be deep enough to cause pain, and we'll talk about later. And on the right photo, you can see chronic caries. It's a caries of the root, but it's only example. What can you see? The same cavity, but it's dark in a color. Why they are so different by visual examination? And you can see it inside the mouth of your child, for example, or patients, or even in yourself. They are so different because of progression of deepness of the cavity or caries. Acute caries is a rapid process involving a large number of the teeth as usual. These lesions are light colors than other types, being light brown or gray. And when we can see acute caries, you should to think about some other diseases, for example, diabetes or other diseases or chronic diseases in patient. Because, as I said, it's a rapid progress. And due to this short period of deepness of the cavity, pulp can't use or can't build dentin inside of it, because demineralization is going on most faster than the pulp can remineralize enamel and the dentin. Chronic caries, it's a long-standing involvement, affect a few number of the teeth or even one tooth, and are smaller than acute caries. Pain is not a common feature because the protection afforded to the pulp by secondary dentin. And arrested caries, which become stationary or static and doesn't show any tendency for further progression. And these arrested caries usually we can see in molars. And if dentist is a good doctor and think about the patient, he won't do any treatment or any drilling on these teeth, and ask the patient to see these tools and come in 2-3 months to see the progression of these caries. And the next classification based on anatomical side: occlusional, pit and fissure, and crown part of the teeth. Smooth surfaces caries, proximal and cervical caries, and root caries. I think it's understandable. Based on virginity of lesion, it's the initial or primary. Caries is one in which lesion constitutes the initial attack of the tooth surface. It's a primary caries, yes, and recurrent or secondary caries is observed around the edges and under restorations. As you can see on X-ray, under the restoration or under the filling, you can see shadow area, and we can understand that inside of it caries cavity is formed based on tissue involvement, initial caries or reversible type. And here be careful. Initial caries, it's only type of the caries which is reversible type. And only this type we can use some appliers of remineralization liquid for restore the tooth, and we can do it. Next, it will be superficial caries, and superficial caries, it's a defect within the enamel. You can see it can be acute or white, it can be chronic or brown or dark in color, but it can be superficial in the same time. Moderate or middle caries, it goes deeper to the dentin and or enamel dentin junction. And in this caries, patient can says about any problems with the pain and deep caries. And here in middle caries and deep caries, we can damage of enamel. We can see damage of enamel. But in middle caries, it's upper layer of the dentin, which is near the junction of enamel. And deep caries, it's inner layer of dentin, which is connected with the pulp. And deep complicated caries, for example, complicated by pulpitis and periodontitis. And here on this slide, you can see photos of different types of caries classification. Initial caries. What can you see on this slide? Only spots, white spots on incisors, and if you take any sharp instrument, you won't see any damage of enamel. It's only remineralization or chemical part of the caries. And I'll repeat it that this is the only stage when we can use applications with remineralization liquids to restore the enamel, because it's only the mineralization part. And from the superficial caries begins not only demineralization, but distort or damage of hard tissues of the tooth. And here you can see superficial caries of the milk teeth, and we can guess that it's a chronic caries because we can see dark colored cavities, then middle caries and deep caries. And in deep caries, we can see even pulp through the thin layer of the dentin. And on this photo, you can see blood, but it's a blood from the gingiva, not from the pulp cavity. Because if it will be open pulp cavity, it won't be caries, it will be pulpitis. Treatment of dental caries, of course, it's two different ways of treatment. Professional brushing and applying a topical fluoride and calcium treatment, it's only for initial caries, and drilling and dental filling for all stages of the caries. Next, it's a prevention of dental caries, and here you can see toothbrushing, and it's understandable. And you can brush your teeth twice a day, but in some cases, when, for example, you see any bleeding from the gums, you can brush your teeth only once a day, and use not hard toothbrush, but soft or middle. Mouth rinsing with special liquids, dental floss, and I said about earlier, topical fluoride application. You can do it by yourself or your dentist Therapeutic dentists can do it. It's for restoration, for protection of the tooth from any aggressive food or drinks or environment. For example, when it's too cold, you can see any sensitivity or pain, tooth pain, and we can use topical fluoride application for prevention this condition. Pit and fissure sealants and pit and fissure sealants, usually we use it after eruption of the tooth in the childhood, after 2 weeks from eruption of the tooth. It can protect pits and fissure of the molars from caries or bacteria and plaques. Nutrition and diet. And the last topic or the last theme of our lecture today, it's pulpitis. What is pulpitis? Of course, pulpitis, as you can understand from the name, it's an inflammation of the pulp. And what is pulp? I hope you remember that it's a soft tissue of the tooth which consists of blood vessels and nerves and lymph vessels. Pulpitis is a condition that causes painful inflammation of the pulp, and it can occur in one or more teeth, and it is caused by bacteria that invade the tooth pulp, causing it to swell. There are several forms of pulpitis, and as you can see on this slide, it can be acute and chronic as all other inflammations in our organism. Acute pulpitis can be reversible as the hyperemia of the pulp, or irreversible. It's a necrosis of the pulp. And chronic can be closed and open. What does it mean, closed pulpitis and open pulpitis? I explained it for you. Opened when the pulp chamber may be opened due to destruction of part of the crown and communicated with oral cavity. And closed pulpitis, pulp chamber isn't damaged, part of the pulp becomes quickly destroyed, resulting in acute inflammatory reaction. By histological classification, we can classify this as serous and purulent. Serous can be partial and total, or it's reversible and irreversible. And purulent, it's a purulent one, with pus formation inside the pulp chamber. And symptoms and signs of pulpitis. They are quite different from the caries, and I missed symptoms of the caries, and let's have it now. As you can understand, caries symptoms can be absent. We can see any discoloration, we can see any cavity in the tooth or teeth. But patient can say that he didn't feel or he doesn't feel any pain at all. But if it's a deep caries or middle caries, of course you understand that patient will complain on acute, sharp pain of particular tooth. And always it's a pain according to some irritants. What types of irritants can you name or think about it? Of course, it's a temperature irritants, cold, extremely cold or hot liquids or drinks. It can be chemical, of course, sweets and other types of the chemical irritants. Salted, spicy food, and the patient will say that during I was drinking some hot tea. I feel acute chest pain, particularly in the, for example, 16, or of course he doesn't know about it, in this tooth, and he'll show you tooth which is pain. But pulpitis symptoms are quite different from caries symptoms. As you can see it on the slide, symptoms of reversible pulpitis and irreversible different too. Reversible one, mild and moderate pain, reaction to physical irritation, usually cold or sweet, the same as a caries, brief duration. When the stimulus is removed, the pain ceases within 1 to 2 seconds. And this is first difference from caries symptoms, because duration it's a difference between pulpitis and caries. What are the difference? We can see that when the stimulus is removed, pain ceases within 1 or 2 seconds. But when it's a caries, immediately patient won't feel any pain after removing irritants. Teeth usually show deep caries or restoration with defective margins. And reversible pulpitis, if allowed to progress, can lead to irreversible pulpitis. And what is irreversible pulpitis symptoms? Spontaneous pain, typically at night. Why? Why at night? Of course, you can think about that at night we are sleeping and we are not eating and we have no any irritants, but it's not true. True answer that is at night we can find working different nervous system as per day. Sympathetic and parasympathetic nerve system. It's oh, I'm sorry. Что-то есть. The same problem with our notebooks. I'm sorry. Uh-huh. Okay. I can see my slides. I don't know, do you see it or not, but let's talk about pulpitis without slides. I can't do anything, and our master isn't here. Can you put plus if you see slides or minuses if you can see it? Okay, let's continue about pulpitis. According to the irreversible pulpitis, pain lingers minutes after the stimulus is removed, usually heat, less frequently cold, and may progress and irradiate. And even it can linger not minutes, even hours and days, and even anti-inflammatory drugs couldn't stop it. Difficult location of the tooth from which the pain originates. And when the pulp necrosis is complete, the pulp no longer responds to hot or cold, but often responds to the percussion. And inflammation, infection extended to the periapical tissue can cause periapical disease. And what is periapical disease can you name? It's a periodontitis, of course. But according to the periodontitis, we'll talk about next lecture. And for today, that will be all. And I'm sorry for our techniques and for our technical sides of the lecture, but I can't do anything. I can't see slides. Thank you for your attention, and we'll meet on the next lecture in 2 weeks on Wednesday at 8 a.m. Thank you and goodbye.